Hi, I'm LaToya Crawford, and welcome to another edition of A Moment of Inspiration. Are you at risk of a heart attack, a stroke, or cancer? Well, how would you know if you've never been tested? Well, I'm here today between two powerful black men in Thomasville. They're here to tell you about a health fair coming to Thomasville that's going to help you get yourself together medically. First of all, I want to talk to Mr. Michael Bryant. He's the president of 100 Black Men of America interest group located here in Thomasville. He's going to talk about a health fair coming your way. Welcome to the show.
Thank you, LaToya.
You're welcome.
First of all, let me say thank you for allowing this opportunity to come and to be with you and to share with you as well as the viewing audience a bit about what is going to be taking place in a couple of weeks. On June 1st from 10 a.m. until 2 p.m. at the Douglas Complex here in Thomasville, we'll have a health fair to address any kind of screening issues that anyone may have, most especially those who ordinarily don't have access to that kind of care. Let me just share, if you will, a bit about our interest group.
Okay.
In that it not only just covers the Thomas County area, but it is Southwest Georgia. It is what it is.
Okay.
Southwest Georgia to give
So we're
direct
talking about
services.
Camilla, Albany.
Well,
Boston?
we'll entertain any kind of membership from any of the men from any of the Southwest Georgia areas, but we directly serve youth from Thomas County, Grady County, and Brooks counties.
Okay. Wow. Now, all the time we hear about health fairs going on, and many people just overlook it because it's something that's always going on. Why is this health fair essential or necessary to attend?
Well, again, I say what I said a few moments ago. A lot of times people don't have the access to health care. And with all of the discussion now going on about affordable health care and everyone will have to have health care at some point, then this is no better time than the present to deal with those kinds of matters. So we want to set it up so that people have opportunity to come in and see if there's anything particularly going on with them. Hopefully we won't find anything, but
Yeah, hopefully.
in prevention we want to be able to share with them this is what is going on and you need to seek help and get some direction.
And it takes place June 1st. The
That's
times
correct.
again?
10 a.m. till 2 p.m.
At the
Douglas Complex.
Now, Douglas is a very large campus. Where exactly on Douglas campus is it taking place?
Well, the event will take place in just about all of the rooms in the main building on Douglas campus.
Okay.
So we'll have men who are with the organization that'll be there to help guide the various attendees to the various rooms where different activities will be going on.
Okay. Wow, that's incredible. Great way to utilize a historical building here in our town.
That's right.
That's awesome.
That's right.
And this great event, this health fair, is in collaboration with Archbold Memorial Hospital. And what better person than Dr. Crenshaw with the bow tie to come in and give us the medical side of this health fair. So welcome, Dr. Crenshaw, to the show. I'm just nervous sitting by a doctor, a medical doctor. It's so good to have you. This is important because every day someone's dying of cancer, stroke, heart attack. So why should people come out and just get screened?
Well, LaToya, interestingly, when you look at it across the nation, this area has been dubbed as the stroke belt. And primarily because the highest incidence of stroke, heart attack, kidney failure resides right in this region. And consequently, we see the highest deaths in the country of stroke, heart disease, kidney disease, and even cancer in this region for so many reasons. And so I think this event is momentous to this region to be able to have individuals come out and receive free health screenings at no cost. And if you had to put a price tag, it would be somewhere in the thousands of dollars if you had to go to a physician or a clinic to receive these health screenings. But these screenings on behalf of Archbold, which that organization has done a fantastic job of collaborating with 100 Black Men to sponsor this event. Perry Mushkin and the Archbold family, they've done a terrific job of providing quality health screenings, which I must say for a town of this size is quite fabulous. And so this event is going to have numerous amounts of screenings available to the entire community. It's going to have PSA screenings. We're going to be checking
What's PSA?
PSA stands for prostate specific antigen. It's the test that tests for prostate cancer. And particularly in the African American community, that's one of the highest risks of death. And
It's like
also
a silent killer.
absolutely, and not only that, but it's a preventable death. It just requires a blood test and an annual screening examination. And many of these tests are available, but unfortunately, certain groups, particularly African Americans, don't take advantage of getting these tests. So this is just, I think, a fabulous time for people in this community to be able to go out and get these screening tests that are available.
Now, Dr. Crenshaw, I'm gonna be honest with you. People run away from the doctor. They don't want to go to the doctor because they got to get poked. They got to take this off, do
Yes.
this. So when you say screening, what all will they have to undergo? Like what procedures?
Well, it's going to be optional. You know, it's going to start out, there's going to be an area where there are going to be vital signs obtained. And vital signs are just checking blood pressure, temperature, heart rate, the things that are non-invasive. Then following that, there's going to be optional tests that are going to be available to each and every participant, meaning that they can come out and receive prostate exams, or they can come out and get even testing for HIV. More invasive, more personal tests that are available for each participant. So there are going to be a numerous amount of tests, even what's called pulmonary function testing. So for individuals, that's the lungs.
The lung.
Yes, and that's a good test for individuals who have a smoking history or have breathing problems. It's a test that's going to be available to them because it can diagnose conditions such as chronic obstructive pulmonary disease, which is a disease that you see largely in people who smoke, and also asthmatics as well.
Amazing. Now, as a doctor, you see these cases each and every day. How many times do you find yourself saying, now, if you would have just come in earlier, that happens?
You know, it's interesting that the old adage, you know, an ounce of prevention is worth a pound of cure. It's so very true. You know, it's interesting, you know, when you see patients who get their routine screening exams every year, it's a wonderful thing to see those individuals, you know, live long, full lives, live to be 70, 80, 90 years old because they got screening exams on the front end. On the flip side of that, it's rather troublesome to see a man come in at 55 or 60 and hasn't had a screening exam, and now he's diagnosed with prostate cancer. And unfortunately now, he's leaving his wife, he's leaving his kids, they're all by themselves, they have no father. And on the other side, if a woman hasn't received her breast exams annually, it's very disheartening for the fact that now they have breast cancer because they haven't received the annual screening exams.
Yes.
Now these children are left motherless. And so it is, I think there's a dire need to be able to have these screening exams available, and like I said, in a town of this size, it's definitely a blessing to be able to have these exams and screenings available.
And you mentioned blessings. You know, a lot of people don't get tested; they don't get screened because of the fear.
Yes.
But fear blocks your blessing. What if they discover that you have prostate cancer, or you have any other form of cancer? So what? You've been diagnosed. Okay, now I go to the next step. What I need to do to stop it from spreading and getting worse. Don't let the fear block your blessing. So again, this event is 100 Black Men of America interest group of Southwest Georgia health fair taking place June 1st in Thomasville, Georgia at the Douglas Complex. And it's June 1st taking place from 10 a.m. to 2 p.m. Don't meet us there. You got to beat us there for this one. If I'm available, I'll be there too. I'll see you there. Thank you for watching A Moment of Inspiration.